Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Thalassemia. Introduction. Thalassemias are inherited blood disorders. Inherited means that the disorder is passed from parents to children through genes. Thalassemias can be mild or severe. Complications from thalassemias are common. People who have thalassemias must closely follow their treatment plans and try to remain as healthy as possible. This program explains thalassemias. It covers causes and symptoms of thalassemias. It also covers diagnosis and treatment options. The blood. Blood carries nutrients, oxygen, and hormones to different parts of the body. It also sends toxins and waste materials to the liver and kidneys to be removed from the body. Blood is made of blood cells floating in plasma. Plasma is mostly made of water with chemicals in it. There are three basic types of blood cells: red blood cells, white blood cells, platelets. Red blood cells, or RBCs, make up almost half of the blood. They are filled with hemoglobin. Hemoglobin is a protein that picks up oxygen in the lungs and delivers it to cells all around the body. White blood cells, or WBCs, fight disease and infection by attacking and killing germs that get into the body. Platelets are small pieces of cells that help blood clot. They also help stop bleeding. Blood cells are formed in the soft, spongy center of bones called the bone marrow. Causes. Thalassemias cause the body to make fewer healthy red blood cells and hemoglobin than normal. This leads to anemia. Anemia is when the blood cannot carry enough oxygen to the rest of the body. Anemia can make you feel cold, dizzy, irritable, tired. Anemia can also cause you to feel short of breath or to have a headache. Thalassemias are caused by changes in a person's genes. Genes tell the body to make certain substances. Every person has thousands of genes. Our genes make us look the way we do. They also affect our health. Genes are found on chromosomes. Each person has 23 chromosomes. Certain genes control how the body makes hemoglobin protein chains. Thalassemias happen when these genes are missing or changed in some way. Hemoglobin has two kinds of protein chains, alpha globin and beta globin. The two major types of thalassemias are named after these protein chains. Alpha thalassemia happens when one or more genes that control alpha globin production are missing. 4 genes normally are needed to make enough alpha globin protein chains. 2 of these genes come from each parent. Beta thalassemia happens when one or both of the 2 genes that control beta globin production are changed in some way. 1 of each of these genes comes from each parent. In some cases, people may inherit changed hemoglobin genes from one parent, but normal genes from the other. These people are called carriers. Carriers may have mild anemia. Some carriers may not have any symptoms of anemia, but carriers can pass on the changed genes to their own children. This means their children may have a thalassemia.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Symptoms of thalassemias are caused by a lack of oxygen in the bloodstream. Symptoms can vary from mild to severe. Some people with thalassemias may have no symptoms. In these people, the hemoglobin can work normally even though they lack certain protein chains. If a person does have symptoms, they often are caused by anemia. Mild anemia can cause a person to feel tired and weak. Mild to moderate anemia can cause other health problems as well, including an enlarged spleen, slowed growth and development, weak and brittle bones. In severe cases of thalassemias, symptoms often appear in the first 2 years of life. These thalassemias cause severe anemia and an enlarged spleen, liver, or heart, dark urine, pale skin. Severe cases of thalassemias can also cause bone problems, jaundice, poor appetite, slowed growth and development. It is important to talk to a healthcare provider if you think you or your child has a thalassemia. Thalassemias can cause life-threatening complications in some cases. Diagnosis. Your healthcare provider will first ask about your symptoms and medical history. A physical exam will be performed. Blood tests are usually needed to diagnose thalassemias. A sample of blood will be taken and sent to a lab for testing. Blood tests that may be done include complete blood count, or CBC, hemoglobin tests. A CBC measures the amount of hemoglobin in different kinds of blood cells in a sample of blood. People who have thalassemias have fewer healthy red blood cells and less hemoglobin than normal. Some people with thalassemias may have red blood cells that are smaller than normal. Hemoglobin tests measure the types of hemoglobin in a blood sample. This test can tell if there are problems with the alpha or beta globin protein chains of hemoglobin. Iron levels may also be measured in a blood sample. This can help determine if a person has anemia caused by low levels of iron or if there is another cause, such as thalassemia. Genetic tests can also be helpful. A family medical history and blood tests of family members will be done. The tests will show if any family members have missing or altered hemoglobin genes. Moderate to severe thalassemias are often diagnosed in early childhood. This is because symptoms usually appear before age 2 in these types of thalassemias. Treatment. Treatments for thalassemias depend on the type and severity of the disorder. People who have mild or no symptoms usually do not need treatment. If treatment for a thalassemia is needed, it may include blood transfusions and iron chelation therapy, folic acid supplements. Transfusions of red blood cells are the main treatment for people with thalassemias. This treatment gives you healthy red blood cells with normal hemoglobin through a needle inserted into a vein. The treatment will likely need to be repeated regularly. Iron chelation therapy removes excess iron from the blood using medicines. Regular blood transfusions can lead to a buildup of iron in the blood. This damages the liver, heart, and other parts of the body. Iron chelation therapy prevents this damage. Folic acid is a type of B vitamin. It helps build healthy red blood cells. Folic acid supplements may be used in addition to other types of treatments. A bone marrow transplant or stem cell transplant may be an option for some people. This procedure puts healthy stem cells from a donor, usually a sibling, into your body. This can sometimes get rid of the need for blood transfusions and iron chelation therapy. Other treatments may also be needed for any complications that happen. Some possible complications of thalassemias include bone problems, heart or liver diseases, infections.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Thalassemias are inherited blood disorders. Inherited means that the disorder is passed from parents to children through genes. Thalassemias cause the body to make fewer healthy red blood cells and hemoglobin than normal. This leads to anemia. Anemia is when the blood cannot carry enough oxygen to the rest of the body. Anemia can make you feel tired, dizzy, cold, irritable. Thalassemias can be mild or severe. People who have mild or no symptoms usually do not need treatment. If treatment for a thalassemia is needed, it may include blood transfusions and iron chelation therapy, folic acid supplements, stem cell transplant. Complications from thalassemias are common. People who have thalassemias must closely follow their treatment plans and try to remain as healthy as possible. Thank you for using Explain.